Hello and welcome to the Joe Ligato Show. I'm your host, Dr. Joe Ligato. And today we're going to be talking about the continuing decline of America, what I am calling the terminal decline of America, because the United States really, it is inevitable that its empire collapses at this point. And today we're going to talk about drug usage in America and how bad it's gone in there. The first article we're looking at is from The Economist, and this is on how fentanyl is spreading the opioid crisis into America's big cities and how the death rate may rise further. So in a world where open data makes spreadsheets with tens of thousands of anonymized entries available to the public, sometimes individual data can still stand out. On Christmas Day last year, according to data downloaded from the Cook County Medical Examiner, the coroner in Chicago and its closest suburbs, 4 people died from opioid overdose. Wow, on Christmas Day, one, a 34-year-old man, had apparently been taking cocaine. Another, a 43-year-old, was suffering complications of chronic ethanolism. All 4, however, were almost certainly killed by the first drug listed as cause of death, fentanyl. They were among exactly 2,000 people killed by opioid overdoses in Cook County last year. 2,000 people in that one county alone. Accounting for close to 1 in 20 of all deaths over the past 8 years, the annual total has tripled. The amount of overdose deaths here has tripled. 9 in 10 deaths have involved something called fentanyl. When opioids first started killing Americans in a very large number, it was disproportionately white people, often in rural areas, who were victims. And I remember this from my childhood, which was America did not care about creating economic opportunities for rural Americans when things like coal and steel manufacturing declined in places of the Midwest. And so these places lacked opportunity, and people really lacked a clear sense of what to do with themselves. And since there was no money and they couldn't make a living and they just didn't feel like they had anything to live for, so they started taking drugs. It was just some of the stories I could tell you, and I've kind of gone into it in other videos, but I'm not going to go into it during this video. And America was okay with that because the oligarchs in charge really hated these rural people who, yes, were white. The oligarchs in charge hated Christians, they hated white people. And so they very clearly, it was not just a matter of negligence, it was a matter of directly doing its best to not help out these areas, to not provide opportunities to these areas. Cities and ethnic minorities generally suffer lightly, yet a far worse wave of death is underway now, caused almost entirely by fentanyl, an incredibly powerful synthetic opioid that can be used legally as a painkiller, but is mostly produced by Mexican cartels and smuggled into America. Okay, in 2021, opioid overdoses killed 80,000 Americans, and it's over 100,000 now, so 6-figure death count per year, and people just don't care. According to data from the Center for Disease Control, a government agency, the figures from Cook County suggest that cities are now being hit hard too, as are ethnic minorities. Of the deaths in Cook County last year, a majority were African American. Nationally in 2021, Black Americans made up 18% of victims, up from 13% in 2018, even though deaths of people of all races continue to rise. Because it is so potent and so easy to smuggle, fentanyl has all but competed heroin made from poppies out of the market. One Chicago-based drug dealer who sells only weed says that fentanyl pills can be had wholesale for as little as $1 each, but that potency is also deadly. Dealers using crude equipment can easily accidentally press a lethal quantity into a single pill. Sadly, that suggests death rates may not yet have peaked. So this is going to continue to get worse. And just to show you what a problem drugs are in America, I have this TriMet study, which we have a summary of. So we see TriMet's efforts to combat drug use on transit, so public transportation. Health experts confirm no public health risk from drug residue, which I don't believe. But we see here the summary. TriMet, a public transit agency, is actively working to address the issue of illicit drug use on its buses and trains. In response to concerns about the rampant use of drugs in their community, TriMet has taken various measures to enhance security and maintain the safety and well-being of riders and employees. TriMet's initiatives include increased security, updated TriMet code, new procedures, collaboration with experts. Let's see what this study found, though. Extremely low levels of fentanyl were detected in 25% of air samples and 46% of surface samples, posing no public health risk. Air and surface samples reveal very low levels of meth, which also did not pose a threat to health. Study did not assess how long drug residue might linger in the air or evaluate ventilation. Okay, there's something here that I'm not seeing that I wanted to see. Where is that? Wait a minute. Let me see. Here's the TriMet study. Okay, I wanted to find, there were a few parts here that they don't talk about that I'm really curious about. Overdose deaths, where is it? Overall findings, okay, wait a minute. There was, I should have highlighted the part, but there was one part in here that showed literally every single, I think it was bus, had some levels of drugs on it. Trying to keep drugs off the street. Wait a minute, I'm gonna find this. It's okay. Overall findings. TriMet findings. Train travel. The air samples were collected by pump. Someone smoked. Unfortunately, whenever drugs, fentanyl use. Where does it talk about all samples found? I think it was meth. I'm trying to find this really quickly. I think they might have changed this article because they added in a few extra corrections. But earlier on, it was saying that all, I think it was trains, had some levels of meth in it. But yes, we could see that things are becoming, it's very difficult to not have to deal with drugs in your day-to-day lives. Oh, wait, here it is. Wait, this is it. Okay. Extremely low levels of fentanyl were detected in 25% of the air samples. Extremely low levels of fentanyl also were detected in 46% of surface samples. Okay. UW researchers also tested the 180 samples taken on the transit agency's buses and trains for remnants of methamphetamine. All the air samples tested. Okay, this is the wild thing, and you can go to this TriMet study and read the entire University of Wisconsin report. But I felt this was funny enough. Oh, no, not funny enough. Funny in the saddest possible way. That on these buses and trains across the entire system, 180 samples, all of the air samples tested positive for very low levels of meth. Okay. And so they may say there's no health concern, but they don't know that for sure. There could be long-term problems. You could just not be able to tell because it's such a small dosage. But literally every single one had meth. And 98% of the surfaces sampled found very low levels of meth as well. Like, imagine that's your public transportation system. China doesn't have to deal with this. I just felt like this was a very wild finding from the study. They can tell you over and over again how no health effects, et cetera, et cetera. But if you are in a situation where your public transportation 100% of the time has low levels of meth in it in the air, and 98% of the time has low levels of meth on the surfaces, that's a terminal decline for your society. It just seems so wild to me that type of thing could happen in Western civilization. And 50 years ago, that could have never happened. But we are living in a different time. And because this has occurred so slowly, people are just not recognizing the decline that's happened. It's a different world. People who are from the boomer generation or the Generation X, they lived at least part of their lives in a different world. And sure, you can feel the kind of malaise over society. Things have become a lot more depressing. But it's so hard to recognize just how much has changed. If you took people, time traveled them from the 1950s to today, they would be shocked at how much worse the future is. Because sure, you have medical advances so people can get over some treatments if they have the money to afford it, because American healthcare isn't free. It's not subsidized in the ways that it should be. But in other ways, in just societal ways, society is ailing. They're People are not involved in their communities anymore. They're more miserable. They feel like there's fewer opportunities. And we can see that they're apparently smoking meth or injecting meth. I don't actually know enough about meth to know. I think it's smoking meth. But they're smoking meth apparently on the trains and buses in America to such an extent that it can be detected in all of the air samples and 98% of the surface samples for this TriMeth study. So just wild things going on in America right now. Again, further evidence of the decline of America. So if you found this video to be informative, to be helpful, please give us a thumbs up. It helps us in the algorithm. Please subscribe to our channel, YouTube and Rumble. It helps us as well. We are trying to pivot as much as possible to Rumble. Please leave us a comment in the comment box, questions, concerns, critiques, anything like that. We're constantly trying to innovate, constantly trying to come up with new things we can be doing. Thank you for watching, and I hope you have a good rest of your day. Bye.